Hello and welcome to the greatest show on television, A Capital Idea. I'm Chaka Fattah, I'm the host, and I represent Pennsylvania in the United States Congress. Today our show focuses on neuroscience. Recently I convened over 40 scientists, researchers, and advocates at Philadelphia University Science Center to discuss the latest innovations in brain research or neuroscience. We brought in Dr. Philip Rubin, the principal assistant to the director of the Office of Science at the White House. There is a rising focus on the federal investment in neuroscience as seen through my own neuroscience initiative, the Fattah Neuroscience Initiative, which is coordinating federal research across agencies, draws on public-private partnerships to promote research in the areas of brain cognition, development, disease, and injury. Now, I've been traveling many places around the world. I've been to Ireland, to Israel. I've met with people from Japan. I'm speaking in Australia. I've talked to leaders from Germany to discuss international partnerships in neuroscience. It's a work that I'm passionate about.
Thank you to Chaka Fattah for not just the great introduction, but more importantly, your leadership, especially on the issues of brain research that have the potential to change so many lives.
Thank you, Mr. President. But today we have a different president. We have Ellyn Phillips, who is the leader of the effort here in Philadelphia and in the Philadelphia area on ALS, Lou Gehrig's disease. Well, let me welcome you and all of our viewers to this week's edition of A Capital Idea. We're going to talk a little bit about the work that we've been doing relative to the Fattah Neuroscience Initiative, focusing on the over 500 diseases and disorders affecting human brains, what the impact is on families. But we're going to do it by looking at one particular circumstance related to ALS. And I have a guest who's just an extraordinary woman who lives in my district, who has been at the very forefront for well over 30 years now of the efforts, in not just in Philly, because you are a bit involved, and we'll get into this, in the research efforts and really, but raising money, raising awareness, helping families that are faced with a loved one who's been diagnosed with Lou Gehrig's disease. So I want to welcome you to the show, Ellyn, and you just, you inspired me. And I want to tell you a little bit about Ellyn's story. Her husband was diagnosed with ALS and featured in the Philadelphia Inquirer in July of 1983. He said that his name was Alan, your late husband. He was a lawyer. He said he was not afraid of dying. He was afraid of living because of what the disease was doing to his control over his own body. And but through that tragedy, you have become really just a lifeline to all of these families, down to the details of ramps and wheelchairs and setting up a clinic and really focusing in on research. So I want to thank you for joining us, and I just want you to tell us a little bit about the local Philadelphia effort and your involvement and where you see our country's ability to deal with this issue, because there's so many people who are diagnosed, tens of thousands each and every year. So welcome to A Capital Idea. Let's talk about ALS and your involvement.
Well, thank you so much for having me, Congressman. It's a wonderful opportunity to be able to be here with you and also to be able to share my story and the story of so many others. ALS did affect my family when my husband was diagnosed in 1982. And it's been over 30 years, and we've been able to make a difference in some respects. And in others, well, I feel like we're still starting from scratch. And by that I mean we've been able, not just me and not just my family, but so many people have rallied around the ALS Association and our cause, including, of course, the Phillies, who adopted us in 1984 as their primary charity. And so we've been able to really raise awareness in the Philadelphia area, and that goes from the Phillies and baseball to people like yourself who've been out there and have been helping us raise the flag about ALS, to our sponsors, to our patients, to our activities. You were at our walk. You cut the ribbon at our walk this past November.
Well, tell us, how many activities do you have in a 52-week year?
More than 52. And that's because one of the great things that has happened is, from a very small group, we've been able to branch out, and we have people who do events for us. Our chapter itself does several very large events. We do walks, and we have 6 or 7 of them. We have an annual luncheon. We have the Phillies Festival, golf outing, etc. But we have patients, we have their families who throughout the entire year will put on events and donate the proceeds to us. So on any given weekend, for sure, there's at least 1 or 2 events going on.
Well, tell me what happens when a family ends up in the situation that you found yourself in terms of the diagnosis happening. What does the local chapter do to step in to provide help?
There's a great difference as to what happened when my husband was diagnosed, because essentially there wasn't a chapter. The chapter that existed on a recording machine in someone's office, and you left a message, and my husband got a phone call back 3 months later. So we definitely wanted to do better than that. Now, depending on the primary, we're trying obviously to get the word out to the primary doctors and also to the neurologists, who may never have seen more than 1 ALS patient in their practice, to know that we have a center at the ALS Center at Pennsylvania Hospital. We have a center at Hershey. We have a relationship up in Lehigh Valley. So depending on where they are, hopefully the doctor, their neurologist, would refer them, let's say, to Pennsylvania Hospital.
Well, I visited that clinic.
You did?
And the center there does a great deal of work, not just on the medical side, but with the social work help, and because families don't really know that, the purchase of picking out a wheelchair, is a very important part of this process. But no matter what happens on the wheelchair side, you need ramps. You actually provide ramps to families so that the wheelchair can get access to the home. So I want you to really, let's start with the science of this, right?
Okay.
So we got 500 plus diseases. We have not really broken the code yet, but you are involved in not just raising money, but funding research.
Right.
That is seeking a cure and effective treatment. The last, I guess, pharmaceutical drug that was approved,
And only.
in the only one, was in the 1981 or so?
1995.
Right, okay, so there hasn't been a lot of progress, and that particular drug doesn't do a great deal to help people.
That's correct, and we're trying desperately. Our national organization has a very robust research program, and it's divided in many different components. There's an investigator-initiated, where an investigator from Penn would apply for a grant, and it would get peer-reviewed. And if it meets muster and the association has enough funding, then it would get funded. But we also approach researchers the other way. We go to researchers and say, you're an expert on this. You're a gene expert, and this gene is in your bailiwick. What can we do? What can you do? And they'll come back with a proposal. We'll fund that. We have drug contracts. We have where we're funding a researcher who's working in conjunction with a drug company. Mm-hmm. We have someone else who's doing, several people who are working the genetic causes, and they're trying to turn off the 2 genes, they're separate genes, that have been identified in familial ALS.
Well, a lot of people don't understand this, but one of the things that happens with people who've been diagnosed is, many instances, they lose their ability to speak. Mm-hmm. I was in Tel Aviv. I was at the international conference, the Israeli Brain Technology Conference, and I met this young genius, a scientist, Philip Lowe, who's been doing a lot of work on ALS and has really developed what he thinks is a solution to some of the challenges. And he's going to do the clinical trials right in Philadelphia.
Oh, that's fabulous.
So we're very excited
Fantastic.
about that. He's developed a brain monitor, a scanner that's the size of about $50. It's non-invasive, and also he's doing some work in combination with NASA. You know, I am one of the lead appropriators for our space agency, but they have a facility, a research facility, and they're working along with him on some techniques that could really help people who are suffering from this disease. So there's a lot going on in the research side, but families who face this, when I was at the Pennsylvania Center, which the chapter has helped to create there, I met a young man who was a correctional officer who ended up with ALS, and him and his wife explained that without the intervention of the chapter, they have no idea where they would be at. You've done so much for so many families. Now, I was at the walk, and Montgomery and Stiles, Mike Stiles, the Phillies organization is just totally committed to working with you. But there were tens of thousands of people out early in the morning, and it was fun. So I think that one of the things that we see with the work that you've done is you've built in a lot of family, and I saw a lot of corporate teams participating, in which they had someone maybe on their job that fell victim to the disease, and now they've rallied around the cause. So tell us how you built the most effective chapter anywhere in the country.
There's a lot of hard work, and we have a lot of dedicated people. The board is tremendous. My late parents were very involved in the organization for many, many years. And we have people who won't give up. And we're all inspired by our patients who are related to us and our patients who have ALS now. And there's just this determination that's infectious, and we just won't quit.
Well, in many of our families from time to time, we face difficulties and struggles. It's amazing to me that your husband is what got you involved in this, but you have remained involved in a leadership role, sacrificing a great deal of your time and effort over so many years. And when you say our patients, I mean, I think everybody can see that you really mean that. These are people who you are, you are fighting this disease with them every day. And so, I think the Philadelphia area has really benefited from this. You sit on a couple of the research review boards. What's your sense about the state of the research? And one of the reasons why I pushed the legislation that the president signed to create this neuroscience collaboration is that for almost any of these diseases, Alzheimer's, autism, bipolar disorder, and almost every disease related to the brain, we have a long way to go. We really have just begun to scratch the surface. And so we now have a unified federal effort in this regard. And but I want to get your sense as someone who's hearing from scientists, hearing from investigators who are working on one of these diseases. What's your sense about, whether we should be investing a lot more? Because I was out at the Society for Neuroscience, and 20,000 researchers there, a lot of these very young researchers who are very energetic, have some great ideas. But one of the things that we have to do as a country is understand that I think that we have to invest in research so that we can improve our circumstances. I think we should be able to find effective treatments for these challenges, and we've done it. For instance, in cancer, we've made a national effort. We now have 800 different treatments and drug therapies, and we've beaten some cancers. We've made some significant improvement in others, but in the field of brain-related diseases and disorders, we haven't had the same progress. And so that's why I'm pushing, and I think we're going to be successful to get both the government and the pharmaceutical industry, and we want to get the foundation world more involved in this issue. But tell us whether you think there's quality research that's not being able to be pursued because we don't have all of the funding that we need.
I'm not a scientist, but I don't think you have to be a scientist to answer your question, and that is there isn't enough money. There, at least when it comes to ALS and neurodegenerative diseases, there's clearly not enough. And I say that as a member of the ALS research project that's sponsored by the Department of Defense. Our budget this coming year is about $7.5 million, and that you can only fund maybe 2 or 3 projects. And I sit on this committee that reviews 100-some abstracts that are whittled down to 50 that then we have to choose 2 or 3. And there's so much being left on the table. And similarly, we think, and there's a bill that's coming up called the Modern Cures Act, where we would like to see Congress allow drug companies, there are possible treatments that have been stopped because they ran out of funding, but treatments are maybe sitting on the shelf somewhere. So there's just so much that can still be done.
Well, I think with your determination, and I think that you are going to be able to penetrate this process in a way in which so many more members here in the Congress and in the U.S. Senate, that's the upper chamber, but I think that we're going to be able to get more focus on this working together. So I want to thank you for coming. I thank you for joining my viewers. This is the best show on TV.
Absolutely.
And you've made it even better today.
High
Thank you very
ratings.
much.
Thank you.
Thank you.
Appreciate it.
All right. Joining us now is Charlotte and Steve Potter from Westchester, Pennsylvania. Diagnosed almost 4 years ago with ALS, the news came as a total surprise for them. Well, welcome back, and I want to introduce the viewers to Steve and Charlotte from Westchester, right outside of Philadelphia, and we're going to continue our discussion about Lou Gehrig's disease. But let me just put this in context. As a congressperson from Pennsylvania, I have a job of representing the people of Pennsylvania, but I also have duties here in the Congress. And one of those is I'm the lead appropriator for all of our science-related appropriations. So I have taken the view that brain research is the most important area for our country to invest in. This is an area where we haven't made the investments, where we have a lot of challenges. We have over 500 diseases and disorders of the brain in which we have made very little progress, is the most understated way I could say it. But in order for people to understand this better, one of the things we're trying to do is to look at one of these 500 diseases. And we hear about Alzheimer's and Parkinson's and autism and bipolar disease, but today we're talking about Lou Gehrig's disease, or ALS. And Steve, you were diagnosed about 6 years ago. Now, y'all have been married for 10 years, and you were diagnosed. Just walk us through. I mean, what happened? And
well, I was almost 50 years old. I was very active. I was playing ice hockey. I was working out, having a great time in life. And I was just having some problems. I had some cramps and fasciculations, which is muscles moving under the skin. And I really didn't understand what it was. I thought maybe I had a pinched nerve or something. And I was starting to get weak in my arm, and I was starting to have trouble writing and buttoning buttons and things like that. And so I went to my doctor for an annual physical. I mentioned some of these things, and they immediately sent me to a neurologist. And they did all kinds of tests. They do MRIs, nerve conduction tests, spinal fluid tests. They probably took 15 vials of blood to do testing. And there's no definitive test positive for ALS. So as you go through the process, you keep hoping they're going to find something, because they're also telling you at the same time that it could be.
Could be any number of other things.
Right.
Well, this is a big problem we have, because there are very few diagnostic tools available that help discern exactly what the disease or disorder may be. So were you misdiagnosed originally, or was it pretty much that once they got all the information, they were pretty dead on with the situation?
On some people, they miss it, and it takes a year or two to get the diagnosis. Right. In my case, it took about 2 months. Okay. And I think they knew it the first month.
So once this happened, I mean, obviously this is a very significant event for the family. Mm-hmm. How did the ALS chapter in Philadelphia help you? How did you get connected to them, and how does it work to help a family in this situation?
I think we got connected to them through Steve's neurologist, okay, who is at the Penn Clinic, and they've been great. They have support groups that we take advantage of. Mm-hmm. We go to the clinic. We do the walks. We do a lot of fundraisers, right. But they've just been great. Anything we need, they're there for us, and we can't say enough good about them.
Right. Well, you've been helping them help other people. I need you to tell me how they help when someone ends up with a family member, like your husband, mm-hmm. diagnosed with the disease, just so you can walk us through why the chapter is important.
Okay. Well, when Steve was first diagnosed, we did go to a newly diagnosed seminar, which helped us understand what the disease is and what we could expect. Okay. They've provided in-home care for us. Steve gets someone who comes in 3 times a week, okay, and helps with making lunches and meals and his stretching exercises.
Well, we should walk through this. The disease, so just so we're clear, is a disease that attacks all of the motor skills. So you're controlled over the motor skills, mm-hmm, over your body, and in many cases, eventually, you have no control.
That's correct.
And not every, but almost always, you could lose the ability even to communicate.
That's true, and it affects everybody differently. Some people it's the arms first, some people it's the legs first, some people it's the voice and the breathing first. For me, it's in my arms. My arms are very weak. I can't really lift my arms up at all. But and my speech is starting to go, but I'm still clear at this point.
Well, now you are at the center at Pennsylvania Hospital. Mm-hmm. Yeah. Tell us about the interactions there.
Well, they're great there. We see the neurologist when we're there. We see the physical therapist and occupational therapists. We see the social workers, right? Mental health,
speech
therapists, and they're all so very helpful. And they, especially with the occupational therapists, they give us tips on how Steve can do things that will make his life a little bit easier. Like when he's eating, they give us like some silverware that had different kind of handles that Steve could use. That's just one example. I mean, they just have so many great ideas to help us.
Well, at any one time, there are about 30,000 people who are suffering from this disease, mm-hmm, and about 5,000 who are diagnosed in a given period of time on an annual basis. So when you think about it, when I was at the clinic and I heard, well, if you buy, now Steve doesn't need a wheelchair, no, but when you buy a wheelchair, once you buy it, that's it. Once you pick it out, that's it. You don't get another one, and that ALS patients don't have this understanding, or they don't have the ramps, and the chapter steps in and provides. I just thought it was amazing that, because I spent a lot of time talking to scientists and researchers, but this was really more about how to help individual families who are faced with a challenge that they never expected to have.
It's quite a shock when you first find out what your challenges are going to be, but the ALS Association has been very, very helpful, explaining things to us, supporting us emotionally and physically, and it's really been a great experience to interact with those people. As one of them said, they're the nicest bunch of people you've never wanted to meet.
They really are, and it's, I just am amazed to see such a commitment. It's one thing when you have someone in your own family, mm-hmm, but it's another thing when you just are I mean, people are so engaged, and I think that it is the kind of spirit we need to have.
Absolutely.
But we also need to do more on the research side. And one of the things that I've done here in the Congress is I have created a legislative framework so that we can do more. And, you know, I'm looking at it from the big picture. We need to go after all of these diseases and disorders. Because someone looking for something related to ALS might find it something that could help us with Alzheimer's. Or might find something with bipolar disease. That almost every time there's a major medical or scientific discovery, it is someone who finds something that they were not looking for.
Right.
So it's not always, you know, just focused on one thing. I'm saying the human brain, and we passed this. The president signed it. I was in the East Room of the White House, and the president walked out and said, "We're going to map the human brain," which we've never done. When we did the human genome, it really has helped us a great deal in terms of cancer, to understand the genes and how to go at attacking certain cancers. And I think we could do the same thing now with mapping the human brain. And say, well, this might cost us $2 billion. And everybody says, well, that's a lot of money. We spend $2 billion a week in Afghanistan. I mean, you got to put all of this in perspective.
Exactly.
Absolutely.
And we spend $200 billion on Alzheimer's care alone. We're only spending $5 billion on research. We need to be doing so much more because it can help so many families. And the point of this discussion is to say that we want to make sure that not only is the ALS chapter helping, but we want the federal government to step up and do even more on the research side so that we can have more success. So thank you for coming.
Thank you for having us.
Thank you for having us, and thank
Steve,
you for your efforts. We really appreciate it.
Greatly appreciate it.
Well, we've made some progress, but we want to find a cure.
Well, we're with
That's
you.
what we want to do. All right?
We do too. Thank you.
Thank you. Thank you both.
Thank you so much.
Okay. Thank you.
Thanks.
I want to thank you, the viewer, for tuning in today. And I want to thank Ellyn Phillips and Steve and Charlotte Potter for joining me. For more information about ALS, visit the ALS Association website at www.alsa.org. Thank you for tuning in for today's edition of A Capital Idea. I'm your host, Chaka Fattah, United States Congressman.